Hello, my name is Daniel Ratkov, and I have the pleasure of presenting to you today on an annual physical therapy screen implementation in an outpatient setting with adult population. My colleagues at the University of Michigan Flint and myself have been working hard this past year to put together resources on what we believe is the most evidence-based and able to be implemented screen at this time. This all comes about through the passage of Michigan's Direct Access Law, which allows patients access to physical therapy services without a physician's referral, which has opened up the possibility for a lot of cash-based services that are within our scope of practice. Specifically, Michigan's law allows for treatment for the purposes of injury prevention and promoting wellness, which is right where this annual checkup or screen would fall into. What are we trying to accomplish with an annual screen? First, we'd like to encourage wellness and prevention. We'd also like to track patient health status over time. One of the biggest arguments you can make is that you see your optometrist every year, you see your dentist every 6 months, but you only see your physical therapist when you have an injury. So we would like to see people in the clinic more often and to offer preventative care rather than just rehabilitation services. Additionally, you can identify problems that are not musculoskeletal in origin and then can refer those to the appropriate practitioner. And also, it's a good way to market your business to potentially attract new clients to your practice. We did a lot of research on different screens that have been implemented throughout the country, and we've chosen to present today on the American Physical Therapy Association screen. It's a comprehensive 10-page document that allows customization and redirection based upon patient findings. It was developed by 5 specialists in the outpatient setting, and it ensures that red flags are caught, and the development involved consultation with each APTA section. So each section had its input on the design of this screen. Additionally, they asked for member feedback in the development process. What was emphasized with the design of this screen was speed, reliability, validity, good specificity, and sensitivity. They used tests that were open source, and they wanted it to be applicable to a wide variety of ages. It's designed to take 30 to 60 minutes of clinic time, and at the end of that, you can provide your client with recommendations for a wellness exercise, or for perhaps scheduling them for an evaluation if you deem that necessary at the time. Charges really vary throughout the country. We talked to a number of clinics, including a few here in Michigan. They also have designed their programs to take 30 to 60 minutes for the screen. And charges range between $75 to $100, although some clinicians have decided to offer the screen free of charge in order to market their business to new potential clients. This is obviously a business decision that your clinic will have to make, but that's a decision that certain clinics have made. These services are not covered by insurances in Michigan, so it'll be all out-of-pocket costs, which should be kept in mind, especially if the plan is to bring clients back each year for the annual screen. Costs should be kept in mind. So here's kind of the outline of how we see this working in a clinical setting. First, just like any intake, paperwork would be filled out prior to the appointment. You ask the client to show up 15 minutes early and fill out health history forms, information about their current condition, any disease-specific tools that your clinic is in the habit of having filled out prior to an evaluation. Those would be filled out as well before the screen. Then the physical therapist would take these forms, review them with the client, and ask additional questions to clarify any information that was given on these forms. Next would come a systems review and vital signs, screening for red flags and the like. Tests and measures would be performed next, and those would be selected based upon your findings from your patient's history. Next would be your assessment of what the patient's specific needs are, and finally what you would like to recommend them to do over the next year to maintain their health and wellness. Here is a link to the APTA template. I pulled it up here. Now, it splits things off into different categories. And for each category, such as goals and aspirations or quality of life, it lists suggested tests such as the PROMIS Global Health or the SF12 or 36 for this category, for example. And these will be included in paper format in your screening binder, as the links are often broken and do not work currently. Demographic information would likely be filled out along with the health history. Current health profile and behaviors. So we've included the weight activity, variety and excess tool, the rapid eating activity assessment for patients, the starting the conversation tool. These are all about diet. We've also included the alcohol use audit C questionnaire and the physical activity guidelines for Americans. That's available online to see how many minutes of recommended exercise the government recommends, as well as assessing whether your client meets those needs or not. BMI, waist circumference, those are things that you can track over time. And then here are a few of the other systems: emotional status, hearing, integumentary pain, vision. These obviously will be at the discretion of the therapist, but again, many of these measures will be included in your binder in paper form for copies to be made as you see fit. And then on to the physical performance examination. The aerobic capacity, the suggested test for this is a 6-minute walk test. Balance, they suggest single leg stance, hexagon agility test, or 4-square step test. Locomotion speed is done through a 10-meter walk test, and also can combine with the 6-minute walk test. And then mobility, flexibility, and functional strength, they list a extensor endurance test, which it lays out how to perform that here. You may have your own preferences as to test for core strength. Functional strength, they list the 5 times sit to stand test and the push-up test, which you may or may not be familiar with, but norms will be included again in the binder. Handheld dynamometer is also a functional test. And then also a test for flexibility, the Apley scratch test, which is the reach behind the back, and the sit and reach test. Postural assessment, they recommend done for every patient. Again, that will be included in your binder. Our recommended documentation for doing that, and also quality of movement. Now, they don't give a specific recommendation for that. However, we've listed additional tests and measures in this PowerPoint presentation, and I've included them in your binder, including additional aerobic capacity tests such as the YMCA bicycle test, 1.5 mile run, Rockport walking tests, additional mobility and functional strength testing such as 30-second chair stand test, which is basically 5 times sit to stand, except 30 seconds of sit to stands, and also vertical jump, which may be relevant for your younger patient populations. Additionally, more in-depth balance tests, which might be useful for individuals presenting with balance deficits, such as the Activity-Specific Balance Confidence Scale, which is a self-reported measure, the Modified Clinical Test of Sensory Integration on Balance, the Mini-BEST test, the Dynamic Gait Index, and the Functional Gait Assessment. So those are all included in your binder, as well as on the APTA's form. They have a link for additional tests here, and those are mostly disease-specific tools, such as for patients with MS or Parkinson's disease or various other conditions. So feel free to check those out. We've also included a selection of home exercise handouts published by the American Academy of Orthopedic Surgeons for major joints, including shoulder, knee, hip, spine, foot, and ankle. So you may or may not find these useful. You may have resources that you prefer and that you've been using, but we decided to include these if you choose to use them. And lastly, we've created a fairly rudimentary documentation form that allows you to record key examination findings and recommendation for your patient, both for your own records and to give to that person to list out what has been gone through during the screening, what tests have been performed, what the findings of those tests are, and then as a result of those findings, what your recommendation for that patient is, whether it be home exercise program, whether it be consult with a physical therapist for an evaluation, whether it be to check with another practitioner. Whatever those happen to be, this is just a nice, easy form to clearly collect that information at the end of your screening. Here are our references, and if you have any questions, feel free to email us. I believe you have our emails. Thank you so much for watching this presentation, and we hope we've provided some good information for you to use in your clinical practice.